South Africa's first tourism and hospitality industry COVID-19 workplace vaccination site will open at Sun City Resort's Convention Centre this morning. The resort aims to vaccinate 7,500 people in 3 phases. Sun City management says that this will start with Sun City staff, service providers and concessionaires. It will then go to family members and finally to all those working at the hospitality establishments in the Moses Kotane District. SABC News reporter Moses Kotane has more on the story.
We are at the launch of Sun City's workplace vaccination site, as you can see here on the wall. So what is going to be happening here, our understanding is that Sun City will have its employees, thousands of them, coming through here for vaccination. And then this will also be extended to other people at some point. But we would like to hear more about this, and we are joined here by the General Manager of Sun City Resort, Mr. Brett Hoppy. Mr. Brett Hoppy, please do tell us about this program, so we get to understand what is going to happen here.
Morning, Timiling, and thanks for having us and thanks for being here today. I think this is a critically important initiative. Through cooperation with the Northwest Department of Health, we've managed to achieve a workplace vaccination site certification, which means that we're able to vaccinate our employees. And we've embarked on extending that, and thankfully the Department of Health from the Northwest has really supported us with that. So our intention is then to move on to the broader hospitality industry, and thereafter we will move on to the broader community. We have a concurrent application with the Department of Health at the moment for a mass vaccination site. So it's a massively important partnership, and we're really thankful to the Department of Health in terms of providing us the opportunity to do this and getting it done. I think it's huge. But I think the most important part of this is once we've done our tourism employees, and those are tourism employees not only from Sun International, Sun City, from all the surrounding properties, I think the most important part of this initiative is to get the certification for the mass vaccination site so that we can bring maximum effect to bear in terms of the Northwest vaccination program.
So this does not necessarily end at you vaccinating your employees only. So the other thing that I want to also talk about is the fact that I understand that you had to close the resort at some point. How has things been, and what are you hoping for in the future?
Well, I mean, it's obviously heartbreaking to close the resort for the second time. But again, since under the present state of regulations, casinos are not permitted to operate and hotels must operate at limited capacity, we chose to close the resort for the foreseeable. We're hoping for good news from President Ramaphosa on Sunday evening. Let's see what happens. But, this industry has been decimated by COVID, and this is our small way of trying to get the industry back to work. If we can assure that in the Moses Kotane local area that all hospitality establishments can tell their customers that they're vaccinated, I'm sure it's going to give customers a great sense of security, and hopefully we're able to get our tourism business back to normality as quickly as we possibly can. But again, I think what is very important here is that the partnership between private sector, local government and national government in terms of driving these initiatives. Everyone in the country has a responsibility to do what they can to try and up our vaccination numbers and assist local government and national government in achieving the targets that we've set out to achieve. So I think it's a very important initiative, and as I say, we're very grateful to the MEC and his team. They've made this possible in terms of the workplace vaccination site, and as I say, we have a concurrent application in for a mass vaccination site. That will be a big celebration for me. We're looking for partnerships with other private sector companies to provide transport into Sun City. So, and if you look at the area that surrounds Sun City, many of those outlying areas, would ordinarily not have access to a vaccination site. So what we're looking to do is use this as a node and bring people in from the surrounding communities, push them through the vaccination site as quickly and as safely as we can, and hopefully in that way achieve maximum impact.
Thank you very much, sir. Brett,
Thank you very much.
Brett Hoppy is the General Manager here at the Sun City Resort. Our understanding currently is that in the Northwest Province, over 270,000 people have already vaccinated, but then that number was probably on Thursday. Obviously, the numbers have increased, and now we are joined by the MEC of Health here in the province, Mr. Madoda Sambata. MEC, firstly, your reaction to this gesture by Sun City Resort, and from the side of government, do tell us about this. What type of partnership is it that you're having with Sun City Resort?
Thank you very much. The Sun City vaccination site, it's a sectoral site. This site is meant for hospitality industry. Of course, we're doing it with the MEC of Tourism and Sun City. The reason we want to appreciate the gesture is that Sun City must be prepared to open its doors for all other sectoral players to come and be vaccinated here, to also indicate the strength and the role of Sun City in the industry of tourism. So this site, it's meant to be a sectoral site, tourism sector. Everyone around here must come to Sun City for vaccination. We have always worked with other departments in ensuring that their sectors do vaccination. That's why we're here. As we're here today, we meant to officially launch. They must start vaccination. We want them to do vaccination almost like education did and social development has done. In a period of less than 5 days, they must have finished the target of the sector. Based on that, we'll then do an evaluation together with them and the department and see what else can we do still with the site.
And what type of partnership do you have here? Do you have government maybe paying for the vaccination or sending through vaccinators, and then Sun City only providing a property where that can be done?
This is an independent registered site. Government is appointing vaccinators. Sun City is responsible for administration of the vaccine. Then we are responsible for distribution of the vaccine to the people. It's both contribution of Sun City as an entity and the Department of Health, Bujanala District.
And one of the burning issues nowadays, MEC, is the fact that there are people who are now saying that some people went for vaccination. After vaccinating, then they had some complications, and some are even contributing or attributing to vaccination the death of their loved ones. What's your reaction as the department, and how is government trying to look into that?
Vaccination complications. The first thing that we must call for our people to do is that be honest as possible when you are interviewed about yourself on the vaccination site, so that anyone who at that stage entering in the vaccination site has some illness or some feeling not well must disclose that. The second component is, because in the vaccination site we don't test people for COVID-19. When you go to you're going to go to a vaccination, first go and do your own test, because it complicates immediately if you have COVID-19 and then you're vaccinated. In this instance, we must thank those that were honest. Almost 5 on the people complicated disclosed that they had COVID-19 active at the time they were vaccinating. Then it complicated. But then the issue that is central is, instead of us assuming that the reason for death is vaccination complication, let's get a formal report of the medical doctor who would have been the last one treating the patient, so that we know that the actual death might either be complication from vaccination or not. In this instance, the card of discharge, the discharge card from a vaccine site, has a number. Whoever complicates home, family members must take that number and call the number, so that it's recorded that Madoda Sambata was vaccinated in Sun City. After vaccination, 3 days or 2 days, he has this complication, so that is sent to relevant people to check whether the complication is on the basis of reaction to the vaccination, or the complication is something that somebody had, but it has been made to deteriorate because of vaccination. We can't hide. Remember, we must report everything. We don't hide any defects or complications after vaccination. But the problem is, when the claim says, I died because of complication of vaccination, we go to a doctor's report. What were you admitted for before you died? And that cannot be hidden by the Department of Health. We register death and their causes as they are. We can't hide. Our communities must report, and the report must first be on the number that is on the vaccination discharge card, so that we track whether it is complication from vaccine. It's recorded. In the past week when I checked, there were around 65 who had adverse complications. By that time, there was nobody who had passed on because there was no one who was registered on death as having passed because of complication of vaccination. We will not hide. Let our people report properly. Let doctors who deal with them tell us exactly the cause of death.
Thank you very much, Mhlekazi, for your time. Mr. Madoda Sambata is the MEC of Health here in the Northwest Province, but as indicated, this vaccination site here at Sun City Resort here in the Northwest Province will start operating at some point, and it will be focusing mainly on the employees of Sun City as well as the service providers, but at some point it will then go to, or rather become a mass vaccination site here in the Northwest Province.